Hello everyone, my name is Ira. Today we are looking at a chapter from the class 12th psychology textbook. It is called Therapeutic Approaches. This chapter deals with treatment of all the disorders that we learned in the previous chapter, which was called psychological disorders. It had many types. I would encourage you to have a look at that also. But, anyways, let's get into this. So, the chapter actually starts with an introduction, but it doesn't really have anything that is, like super important. So, we're just gonna skip it. Let us go to the actual theory. Nature and process of psychotherapy. Psychotherapy is a voluntary relationship between the one seeking treatment or the client and the one who treats or the therapist. So now over here you can note that they use the word client and not a patient as one would do in a medical setting. Okay, so make sure that when you're writing it in your answer sheets, also use the word client because that would be correct. The purpose of the relationship is to help the client to solve the psychological problems being faced by him or her. The relationship is conducive for building trust of the client so that the problem may be freely discussed. Well, this is quite obvious actually. So let's just take a scenario which just came into my head right now. Say you have a friend called Leah. You tell Leah that you like pineapple on pizza, thinking it would be a secret, but then Leah just goes around and tells everyone, and now you're kidnapped by the Italian mafia. Sorry, that's kind of stupid, but it can help you. Remember how you are very unlikely to confide in someone who does not keep your things confidential. So, and the whole point of therapy is to have someone being the client being able to vent to tell you like whatever they feel like telling. Okay, so it is important, like mandatory, for the relationship to be built on trust. So, psychotherapies aim at changing the maladaptive behavior, decreasing the sense of personal distress, and helping the client to adapt better to his or her environment. Okay, so maladaptive behavior basically means something that is not helping you adapt to your environment, or something that is, let's say, stopping you from well being yourself. I can think of an example right now would be like a eating disorder or a social anxiety or something like that. Okay, decreasing sense of personal distress, quite straightforward, and helping adapt to climate. Inadequate maternal, occupational, or social adjustment also requires the major changes to be made in an individual's personal environment. Okay, so maternal means you have no love life, occupational means you are jobless, and social adjustments, well, being woke. Okay, so that's all the things that can, lead you in a psychology office. Anyways, all psychotherapeutic approaches have the following characteristics. Okay, so now here there are points. It would be great if you actually write this down, but I'm aware that most of you are just listening to this as you're walking on the streets or you're getting to your bus or whatever, and no one really wants to write it down, so I'm just gonna read it out. If you remember, great. If you don't, please tell it again. Okay, so the first one is systematic application of principles underlying different theories of therapy. Okay, so what does this mean is a little further over here. Okay, we are going to be having something called psychodynamic therapy. Now, if we all remember the previous chapter, we had Sigmund Freud, that guy's a theory called psychodynamic theory. So, all these theories, right, from the previous chapter have been converted into working things for psychology, and those are called therapies. So, that is what this point is actually talking about. Point 2, the persons who have received practical training under expert supervision can practice psychotherapy, and not everybody. So, this is a very common problem in, well, especially like for us in classes. You move a little too much, you're a little too distracted one day, and suddenly you have ADHD. So yeah, you cannot do that, okay? You cannot just look at John, who like really likes playing with trains, and be like, "Hi, yes, autistic." No, please don't. Third, the therapeutic situation involves a therapist and a client who seeks and receives help for his or her emotional problem. Okay, so I think the focus here is the word emotional, because you cannot break a leg and go to your therapist like, please fix this. That would be a doctor. And the interactions of these two people, this is the fourth point, by the way. The therapist and the client results in consolidation / formation of a therapeutic relationship. I will be speaking more about this therapeutic relationship, hopefully, in this very video. And obviously, the whole point of going to therapy is, to come out a better person. This is a consolidation or formation of all your problems, whatever is there. This is a confidential, interpersonal, and dynamic relationship. So, big words here. Confidential means kept a secret, which means that Leah does not get to tell anyone else about your liking of pineapple on pizza. Here you have interpersonal, which means related to other people. There is another word, it's called intrapersonal, which means related just to yourself. So please take note that this is interpersonal, because you have like a person in front of you, the therapist, who you're communicating with. And your third thing is dynamic. Dynamic means changing. This human relationship is central to any sort of psychological therapy and is the vehicle for change. Okay, so even more points now, and these seem actually more important than what I listed out previously, but honestly, just learn both. All psychotherapies aim at a few or all of the following goals. So, these are goals of psychotherapy. It has 10 points. We are gonna go through them one by one. First, reinforcing clients' resolve for betterment. For example, like say John has an alcohol addiction. Now, John has been sober for 2 months and he's going to therapy. And then one day he comes in and he's like, you know what, I really want to drink, really want to drink. So, your job as a therapist would be to be like, no, don't, because you have come so far, you have done so well. So, basically, you're reinforcing John's resolve of giving up drinking. It's just an example. I don't even know if it's super accurate, but we can use it. 2. Lessening emotional pressure. Obvious. The third one is unfolding the potential for positive growth. Potential is, like the underlying ability, you could say, for positive growth. Fourth is modifying habits. Note the word modifying here. does not say changing habits, right? Because habits are really, really hard to change, and sometimes it's easier to just find an alternative. Like, for example, you have, like, you really like to eat at 3 o'clock in the afternoon after lunch. You have your lunch and then you have something, even if you're not feeling hungry. And you do it every day. And it's like a chocolate bar, or it's something fried, or chips, or something. Now, this is like a habit that you can't really break for whatever reason. So, what you do is, instead of all the chocolate bars in your fridge, you can maybe put like ice cabbage or something, lettuce, and then you're munching on that like a rabbit instead. So, yeah, that's modifying habits. Then you have 5, changing thinking patterns. Not very easy, one would say, to do, but you can do it. 6 is increasing self awareness. 7, improving interpersonal relationship and communication. Again, note the word interpersonal, which means with other people, with your parents, your friends, or whatever. Then you have 8, facilitating decision making. Now, note that a therapist by himself cannot exactly give advice. It is like not really allowed for a therapist to be giving advice. What he can do is he can encourage the client to find like his own solution to the problem. So you can help the client to, make his decisions, but you cannot make it for them. So that is facilitating decision making. 9, becoming aware of one's choices in life. And 10, relating to one's social environment in a more creative and self aware manner. Well, I don't really have a example for that, so we are just gonna by heart that one. Just the 10 point, it's a little weird, I don't know, but just learn it.